Good day everyone! For today's video, we, the Group 4, will discuss important information and facts about ectopic pregnancy. So sit back, listen, and relax.
Usually, a pregnancy commences with a fertilized egg. The fertilized egg typically adheres to the uterine lining. Whenever a fertilized egg is implanted and develops from outside the uterus main cavity, an ectopic pregnancy occurs. An ectopic pregnancy most often occurs in a fallopian tube, which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes, an ectopic pregnancy occurs in other areas of the body, such as the ovary, abdominal cavity, or the lower part of the uterus, which connects to the vagina. Unfortunately, an ectopic pregnancy cannot develop properly and it is not possible to save the pregnancy. If left untreated, the fertilized egg cannot thrive, and the developing tissues may result in life-threatening hemorrhage. These are the predisposing factors for ectopic pregnancy: previous ectopic pregnancy, prior fallopian tube surgery, previous pelvic or abdominal surgery, certain sexually transmitted infections, pelvic inflammatory disease, and endometriosis. The majority of women who experience ectopic pregnancies have no previously identified risk factors. Sexually active women must be mindful of their body's alterations, particularly if they display symptoms of an ectopic pregnancy. Indicated here are the clinical manifestations for ectopic pregnancy: sharp abdominal or pelvic pain, referred pain to the shoulder, syncope, shock, sonogram that shows empty uterus, intermittent lower and upper quadrant pain, and endometriosis.
The next one is the assessment. A pelvic exam can help your doctor identify areas of pain, tenderness, or a mass in the fallopian tube or ovary. However, your doctor can't diagnose an ectopic pregnancy by examining you. You need blood tests. A complete blood count will be done to check for anemia or other signs of blood loss. If you are diagnosed with an ectopic pregnancy, your doctor may also order tests to check your blood type in case you need a transfusion and an ultrasound. The clinical diagnosis of ectopic pregnancy is based on a combination of serum quantitative human chorionic gonadotropin levels and transvaginal ultrasound findings. For the diagnostic findings, ectopic pregnancy can be hard to diagnose because symptoms often are like those of a normal early pregnancy. This can include missed periods, breast tenderness, nausea, vomiting, tiredness, or frequent urination. Often, the first warning signs of an ectopic pregnancy are pain or vaginal bleeding. Ectopic pregnancy is most common in women of reproductive age who present with abdominal pain and vaginal bleeding approximately 7 weeks after amenorrhea. These findings are non-specific and are common in patients who may miscarry. For the physical findings, it includes a normal or slightly enlarged uterus, pelvic pain with movement of the cervix and a palpable adrexal mass. Findings such as hypotension and marked abdominal tenderness with guarding and rebound tenderness suggest a leaking or ruptured ectopic pregnancy.
So, let's proceed to pharmacologic therapy. So, first is methotrexate. Methotrexate injection is the favored medicine for treating ectopic pregnancy when surgery is not necessary. And methotrexate is a type of medicine called a folic acid antagonist. So it works by blocking an enzyme, the hydrofolate reductase, which is involved in making cellular proteins. And by blocking this process, methotrexate keeps cells from copying themselves and dividing into more cells. In terms of an ectopic pregnancy, methotrexate stops the pregnancy from continuing to develop. And second is leucovorin, is the active form of folic acid and it is used to lessen methotrexate's negative effects and shield cells from its effects. And last is mifepristone. So it is the drug that blocks a hormone cells progesterone that is needed for a pregnancy to continue.
A patient with a diagnosed ectopic pregnancy should immediately transferred for surgery if first, she has peritoneal signs or hemodynamic instability. Second, if the initial beta human chorionic gonadotropin level is high. Third, if the fetal cardiac activity is detected outside the uterus on ultrasonography. And lastly, if there is contraindication to pharmacologic management or therapy. So we have here the salpingectomy. So it is a surgical procedure where one or both of the fallopian tubes are being removed. It is performed to treat certain conditions of the fallopian tubes and ectopic pregnancies, and as preventive measure for women at high risk of developing ovarian cancer. Next, we have here the diagnostic laparoscopy. It is a surgical diagnostic procedure that is used to examine the organs inside the abdomen as well as other closed spaces such as knees. It is a low-risk, minimally invasive procedure that requires only a small incision. Lastly, we have here the segmental resection. This is the resection of the ectopic mass that is used for unruptured ischemic pregnancy because salpingectomy may cause scarring and subsequent narrowing of a small ischemic lumen.
So here's the facts about ectopic pregnancy. It may cause the implanted to burst or rupture due to the fact that an ectopic pregnancy usually occurs in one of the fallopian tubes. The tube may rupture or explode as it expands if not detected in time. When an ectopic pregnancy ruptures, it causes potentially fetal internal hemorrhage. Next, almost all ectopic pregnancies, more than 90% occur outside of uterine cavity in fallopian tube, but they can also implant in the abdomen, cervix, and cesarean scar. This is reflected in the fact that the majority of ectopic pregnancy occur in the fallopian tube, with the pulmonary part of the tube being most common place. 80% of them actually occur there. An ectopic pregnancy will never be viable due to the fact that it cannot be transferred or placed in a location with the uterus where it can develop normally until delivery. Both medication and surgery are used to manage ectopic pregnancy. Ectopic pregnancy is the result of slow human reproductive physiology that allows the conceptus to implant and mature outside of the endometrial cavity, which ultimately ends in the death of the fetus. Essentially, it is the extrauterine pregnancy, with the majority of them occurring in the fallopian tubes. Ectopic refers to something that is improper. The highest rate ectopic pregnancy occur in women 35 to 44 years old. Furthermore, an ectopic is 4 to 8 times more likely to occur in pregnant women over 35. Women over 35 years old are more likely to experience pregnancy-related issues. And lastly, it is dangerous and life-threatening. The fallopian tube may become completely detached due to an ectopic pregnancy. The ruptured tube may cause fetal hemorrhage if left untreated.
That's all for today. Thank you for watching.